Special program, as some of us probably know. I believe you've all been staying safe and keeping abreast of all the information on social media concerning the ongoing COVID-19 pandemic. I first of all want to thank the church leadership for giving us the opportunity to educate us and enlighten us on COVID-19, particularly as people gradually return to normal activities. May God continue to protect us all in Jesus' mighty name. So on behalf of the medical team of Redeem Church of God Living Spring International, I want to welcome you to this special program, the special Sunday program, which we call COVID-19 Update, the past, the present, and the future. Today's program is going to be in 3 sessions. The first session, we are fortunate to have an expert who is an infectious disease expert who has been in the forefront of COVID-19 pandemic. He has seen it all, from the mild symptoms to the most severe cases of COVID-19. So he will kind of give us an updated, brief overview of the COVID-19. And that session will be followed immediately by our own Pastor Mrs., who is also a specialist, a pathologist. She will be talking to us about the COVID-19 testing, what it's involved, what it entails. So we also have that understanding today. Then I'll follow that with areas of controversies, what I call the myth busters, things that are all in the social media, in the internet, that may be causing confusion. So we'll also try to clear that out today by the grace of God in Jesus' name. I want to encourage us, if you have questions, if you have specific questions related to COVID-19, please send it to us. You can send it, I think, on YouTube, on Facebook. We'll get those questions, and we'll try as much as possible to tackle them this morning by the grace of God. And that's about it. So I hope you enjoy it. I hope this will be impactful and we have a positive manifestation in our lives in Jesus' mighty name. Thank you for listening.
Good morning, everyone. Thank you for inviting me, Pastor Esan. I'm glad to be here. I'm Dr. Emmanuel Frempong, and I'm an infectious disease doctor. I've been working in Pittsburgh for some time now. So I've been asked to talk a bit about the coronavirus, the past, present, and the future. I know this virus has caused a lot of havoc, and it has stifled everyone. The coronavirus is not something new, I must say. It's a family of viruses that have been found, that are found in the humans and animals. So we have the animal coronavirus and then the human coronavirus. Most of them, the human ones, can make you sick, and you're the type of symptoms you get are like having a flu, but a milder form of that. However, most recently, getting to the end of last year, a new strain of the virus started infecting humans, and scientists believe that this came from animals. And somehow the animal virus has been able to make it to humans and able to survive and causing the coronavirus disease that has stifled all of us. The virus that caused COVID is named SARS-CoV-2. We know about the SARS before. SARS stands for Severe Acute Respiratory Syndrome. And there was SARS outbreak in the past. So that is SARS-1, and this is a similar, another SARS, so it's labeled what, SARS-2. So at the end of last year, we started hearing that this animal strain is causing diseases in humans in China, and it started in a city called Wuhan. So initially it was called the Wuhan virus. And you know, China is a very big place. A small town in China can have at least 1 million people. So the virus started spreading rapidly through China, and with globalization and traveling, it made its way toward Europe and to the rest of the world. In February of this year, the World Health Organization designated the disease COVID-19, meaning coronavirus disease, and because it started in 2019, we added, the 19 was added to that. So the COVID-19 itself is just the disease, but the virus that causes the COVID-19 is labeled SARS-CoV-2. As I mentioned earlier, the coronavirus is not something new. There are human coronaviruses. There are about 7 of them, and they are put into some subgroups: the alpha, the beta, the gamma, and the delta. So all along, we have had coronavirus around, and it can cause something like a small cold. And the 4 common ones are the ones that we know. And then there have been outbreaks of severe forms of coronavirus. The first one was what we call the MERS coronavirus. That is it was labeled the Middle East Respiratory Syndrome. And also the SARS, which is what? The Severe Acute Respiratory Syndrome. And now this is also similar to SARS. So there was a first SARS, and this is the second SARS. So that's why they label 2 over there. So these are the less common ones. The MERS and the SARS have somehow disappeared, and the SARS, or that caused COVID-19, is similar to the MERS and the SARS in the past. So, as I will mention later on, we are hoping that this may also disappear on its own. When you are exposed to this virus, within 2 weeks, you can fall sick. Having said that, we now know that there are people who have the virus, but they don't fall sick. So I have to mention that the coronavirus or the COVID-19 disease is an evolving science, meaning that every day we get new data, every day we learn something new. So the information today may change tomorrow. So we have to stay tuned for all this. Earlier, data from China mentioned that the virus, when one acquires it, within 2 days, about 3% of people fall sick, and within about 12 days, about 98% people fall sick. We know that this is not the case now, but this is to emphasize that this is a very aggressive virus, and it can spread very rapidly. Now, getting exposed to the virus, as I mentioned, you may fall sick, you may not fall sick. And even if you fall sick, some people just have mild sickness, and some unfortunately go on to develop severe sickness. But the good news is that 85% or at least 80% of people just have the mild form of the disease, meaning that they feel like they have a flu-like symptoms, like having a flu or the cold, and then they get better later on. About 14% go on to develop severe shortness of breath, requiring people to be put in the hospital and being given oxygen, and some, about 5%, move on to require ventilator support. That means they get into the ICU, where that is a critically sick patient. Earlier data showed that the fatality rate, meaning that number of people who died from this disease compared to those who get it, I mean, the total number is about 2.3%. But as we know, it varies from places to places, from one part of the world to the other, and even the United States, it varies from county to county. And over here, we know that it's more outbreaks in the nursing facilities. Now, there are other factors that will push a patient who is infected with the virus to get critically ill. If you have underlying diseases like heart diseases or diabetes, hypertension, which is not well controlled, other form of lung diseases, cancer, and kidney diseases, smoking and obesity, all are what we call the risk factors that will push you into either making your sickness mild or severe. So having said that, we know that middle-aged and older people are more affected, and this is not surprising because as we all age, there comes what? Diseases like hypertension, diabetes, and co. So it's not that surprising. I know that there have been a lot of speculation as though children don't get sick or children are not affected. No, children can be can have COVID, but a lot of the children they get better on very quickly. So the immune system is something that is very important. What are some of the symptoms when you get this virus? Most patients will get fevers and fatigue. Some people get dry cough. Some get muscle pain, and some just lose appetite. And some also go on to be coughing up a lot of phlegm. And the complications from this disease can be very severe respiratory distress. I've seen cases where patients, you are talking to them, they are fine. Within 5 minutes, you walk out of their room, you come back, and what we always say in the hospital, they are crashing, meaning that they have very severe shortness of breath that will require artificial support. Other complications that can happen are irregular heartbeat and heart injuries, which Dr. Ula will be talking about that, so I'll leave that to him. And sometimes you can get even blood clots that can go into your lungs and cause strokes. Now, how do we diagnose this disease from the laboratory? I mean, the main thing is more of the clinical presentation. When the patient comes, what they complain about will give you an idea whether they are having the virus, this type of virus or not. But there are other what we call help from the lab that helps us to also confirm the diagnosis. I will leave this to Dr. Pastor Kemi Esan to talk about this. So what about treatment? So far, we do what we call the symptomatic treatment. That means we treat your symptoms. If you are having cough, we help you with that. If you are having shortness of breath and you lacking enough oxygen, you are giving what? Oxygen supplement. If you are having fevers, you are giving Tylenol and co. There has been speculation about using hydroxychloroquine. That is chloroquine that most of us in the audience have taken before in the past. If you were born in Africa, chloroquine is something that you have taken in the past. Now, studies have shown later on that this is not helpful. So most people, in the most hospitals, we have stopped using that. What about over-the-counter drugs? That is what I've written, OTC, and herbal medications. My philosophy is that if something has not been well studied, I try to avoid it. I know people, I'm not saying that herbal medications don't work. They do. The problem with herbal medications back home in Africa is that we don't have standardization. So even if the herbal medicine is potent, you don't know how much you should be taking and whether that drug interacts with your other drugs that your doctor has written for you. So until there are studies, I would say let's avoid that. The only medication right now that is promising is what we call remdesivir. It has shown to shorten the duration of the illness. So if maybe you are sick and you were going to be sick for 3 weeks and you are given this medication, it may shorten it down to probably a week less. Now I know most of you are not working in the health system and may not understand this, but I just wanted to show you a usual chest x-ray about a patient who has COVID and having difficulties breathing. All the white fluffs you see on the x-ray are just a damage to the lungs. And when you get a CT of the chest or a CAT scan, we call something the crazy paving pattern. So those of you who have this type of pavement in your house, in your driveway, this is similar to what we see when we do the CAT scan. If you look at the picture that is shown about the pavement, is similar to what is the COVID virus, the damage it does to the lung. We've also seen cases where patients present with redness of the toes. So this is something that you also have to watch out, that if you are getting, if you are having a flu-like symptoms, something like a cold, and your toes are turning red, please go and see your doctor because it could be COVID related. Now, is there any hope for the future? As I mentioned, COVID is an evolving science, so everybody should stay tuned. Every day we get new data, so things that are said today may be different from things that are said tomorrow. Recommendations today may change tomorrow. 2 days ago, or the 11th of June, that should be about just a day ago, 1 or 2 days ago, there was a report in Missouri, a place called Springfield, where 2 hairstylists have documented COVID virus. They were able to take care of 140 of their clients, and there were 7 co-workers who were working with them. They knew that these 2 hairstylists have COVID virus, but they followed the recommendation of distancing their clients, putting on a mask. The client and the hairstylist put on their masks. The clients came in for only appointment, not just rushing into the place and sitting down and waiting for their turn. And so far, after these people were exposed, we've tested 46 of the clients, and everyone is COVID negative. And the rest were asked to stay home for 14 days, which is the incubation period for the virus, and nobody is sick. So this has become a very interesting, and more studies, the health department in Missouri is looking into that. So there is hope that probably if we listen to the recommendations and do what is required, life can gradually return to normal, even if you are exposed to somebody, even in your own household, who has COVID. For myself, being a doctor, if I get COVID today, I know for sure that my wife is going to send me down to the basement room. So, as mentioned, COVID is a new virus that we are learning a lot from it. And the only fear right now is that the flu season, after the summer, the flu season is the next. And there is a bit of concern that if the COVID still hangs around and we have both the flu and the COVID, it can be catastrophic. But there is also signs that some of the COVID virus is becoming milder and milder and not aggressive as the new strains are evolving. And as Christians, let us all pray that the virus may disappear on its own. As I have shown this slide earlier, that if you look down to the last part of the slide, there was the MERS and the SARS-1, and now we have what? The SARS-2 COVID virus. And so, as the MERS and SARS disappear on their own, we are also hoping that this could also happen. But even if it comes to stay with us forever, at least we are hopeful that we will have some medications and some vaccines in the near future so that life can go back to normal. Now, the COVID virus has a message for all of us, and the message is, how do I put this? So, we just celebrated Mother's Day. Everybody loves their mothers, and Father's Day is coming soon. You probably will not hear about it, and if you're a father and your son or daughter calls you to wish you happy Father's Day, you should be thankful because you are lucky. But Mother's Day, nobody misses it. When I first came to the United States, I was told that the only one day that the telephone companies make most of their money is what? The Mother's Day. So the COVID virus behave also like the human, so like all of us. And the message from the COVID virus says, avoid men, meaning avoid touching your mouth, eyes, and nose, but follow women, meaning wash your hands, obey social distancing, put on your mask, exercise and eat well, because if you exercise and eat well and you get sick, your body can fight it. It's part of the immune system. And no unnecessary traveling or gathering. So I'm not saying people should not gather, people should not go to church, or people should not travel, but do it if only needed. But hopefully with time, things will become milder and milder. So I wish everybody a good morning and a good summer. Continue to stay tuned and follow the guidelines and recommendations from your healthcare professionals and your primary care physician. And if you have any question, this is my email with my long last name that my family gave me, Frempong Manso, and the E stands for Emmanuel at upmc.edu. Once again, I thank you very much for inviting me here. Thank you, and God bless.
Hallelujah. We bless the Lord for that message, taking us through what we should know about COVID-19, and we thank Dr. Frempong for sharing with us some of his expertise. It's very good to know facts, because when you know a fact, then you know how you can also protect yourself. Talking about laboratory testing, that's what I do. And in the US, you know, at the earlier parts of this epidemic, we kept hearing lab testing, lab testing, lab testing. And the question was, what was this big deal about lab testing? And the reason is, to control COVID, we need to know who's infected, we need to know who has been infected in the past, and we need to know what we can do to keep other people from being infected. And laboratory testing lies in the middle of all these. So tests for COVID-19 fall into three main categories, what we call the viral tests or the nucleic acid tests, our antibody tests, and also our home testing kits. So talking about The SARS virus, we've already heard about the name, and that is, it's a severe acute respiratory syndrome coronavirus 2. This picture just shows you what it looks like under the microscope. So that's how it got its name, corona, because it looks like a crown. So it has the spikes on top of it, and they're made up of proteins of different types, and it's surrounded by an envelope. And inside is what we call the RNA virus, which is the part that has like the genetic code of the virus. This virus cannot move by itself, which is why it needs you to put it on your mouth or in your nose, right? You avoid the men. So it needs you to do it yourself because it cannot move by itself. And the tests that we have different types of tests. So the nucleic acid tests are actually trying to find out if this person has that RNA in their nasal or respiratory tract, because that's where the virus multiplies. Then we have antibody tests that are proteins the body makes to fight against this virus. And then we have what we call antigen tests, which are tests that are directly checking to see if those proteins on the outside of the membranes and the envelopes, those proteins are present. So we have different types of tests that are used. So right now, the most common one that everybody is talking about when they say, do we have tests? Do we not have tests? Do you have everybody that wants a test can get one? We all know that's not really true, but everybody that needs a test in the US right now can get one. If you have symptoms and you get in touch with your doctor, they'll send you to the places where you can get a test done. If you've been exposed to somebody who was confirmed to have COVID, then if you also reach out to your doctor, hey, I've been exposed. I mean, like people who are taking part in the protests right now, all of them have been told to go for testing, right? Because they've been exposed to a lot of people. So if you've been exposed, if you get to your doctor, contact them, they'll tell you where to get it. But you can't just walk into those places yourself. You need a doctor to tell you to get it. So we do the nucleic acid tests, and they do take swabs, long swabs, push it up the nose to swab the back of the throat. Sometimes they might take you through the mouth and different ways. And then the tests can only be performed in specialized laboratories, which is why not everybody can do it. It's only special hospitals that have what they call PCR tests. They have ways of amplifying, multiplying that viral, the RNA, to detect it. So it's expensive, it needs specialized people to do it, and many of the tests would need you to collect a number of them before you run it. So it's an expensive thing, it's a specialized test. But then it is very, very, very accurate. It's very reliable. So I have here a few colored pieces, and when you have, assuming we're looking for red standing for COVID, right? If you have a test whereby you run different people and you want to pick out only those people that have the red, assuming those are COVID, and the test goes not red, 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 not red, not red, red. That test we can say is very reliable. We say it's very accurate because it says what it means and it means what it says. That is, if it tells you no red, that is no COVID, you know that person doesn't have it. Or rather, it's not detectable at that time. If it says red, that means this person has it. So the nucleic acid tests are very, very reliable. They're very good. They're very powerful. But like we said, they're pretty specialized and could be expensive. And you find that they're only useful during the time of acute infection. That is the time when the virus is still multiplying in the person, which is within about 2 days to about 2 weeks of infection. That's the only time it's useful. And if that specimen is not taken well, if it's not properly taken or they take it from the wrong place, then guess what? It will still give a negative result. Or if it's taken before it has multiplied enough, it will still give a negative result. Or if the test is taken after the person has recovered, it will be negative. All right? So you have to know what time to test. So the fact that you've been exposed and they tell you have a negative test doesn't mean you should just say, therefore I don't have it. You might still be in the period that they call incubation, and the thing is still multiplying. So you have to be careful about that. So that leads to the second type of test. So we have the first one is the nucleic acid test. The second one is the antibody test, whereby they check the person's blood to see whether the person has been infected before. So the antibody test cannot tell you whether the person is infected right now, but it would, because it doesn't start, it's not positive till about 2 weeks. All right? It doesn't get positive till about 2 weeks after the person has been infected. So it can't tell you whether the person has the test right now, but it will tell you, oh, this person had the test had the infection a month ago and has developed antibodies. So the antibodies are the proteins the body makes to fight this coronavirus. And there was a lot of, happiness, in quotes, initially, that, oh, we have lots of antibody tests. But guess what? Because the FDA is the group that makes sure tests are reliable and good before we send it out, they were doing a lot of emergency accreditation of tests. And they found out that out of all the tests they accredited, if we are looking for red things, the test would say, you pick up this one and say red. It will pick up this one and say not red. This one, red. This one, red. This one, not red. Then this one, not red. In other words, it was totally unreliable. So they had to actually withdraw all those tests. So there was a time when it was like, oh, we have lots of antibody tests, then we're going to start it, and then you hear again, no more testing. So that was the problem. Many of those tests were not reliable. So now they have a few reliable ones, and they use it to follow up who has been infected in the past. And they also use them for people who have been infected in the past, who have developed good antibodies, because there are also different types of antibodies. Good ones, they do what they call convalescent plasma. So you might have heard about that, whereby they use plasma from people that have recovered to treat people that have current disease. So antibody tests are tests done on blood to find out whether the person has been infected before. And then the final type of test are the home testing. So this is the ideal. We want tests that everybody can do at home, such that without having to go to your doctor, you can test yourself if needed. Without going to a doctor, just like where you can go to a pharmacy and get a pregnancy test, we want people to be able to go anywhere and get a test whenever they want it. That is the ideal, and that is where we are going. So that is actually the future. So right now, in the past, we had a problem rolling out tests, but now if you need a test, you can get a test. And right now, we're doing the nucleic acid tests. We're also doing antibody tests to find out people who have developed immunity. And those are also needed so we can decide, oh, people can go out freely because they have antibodies against this disease. And of course, the future is having home testing kits, whereby everybody that actually wants a test can get a test. That is, if you've been exposed, you've gone to a party or whatever, you can just walk into a pharmacy and buy the tests, and it would be a reliable test. It has to be an accurate test, a test that when it says the person has it, we know, yes, he has it, or when they say the person does not have it, we know the person does not have it. So that's where we're going to, and we hope we will get there shortly. Right now, a few researchers are doing research using home testing kits in some cities, and we look forward to the time when everybody will have access to kits. It might just be saliva that you put in it and check whether you have been exposed, because when we know people who have the infection, then they can isolate themselves and not spread it, and we can also do contact tracing. So testing, isolation, contact tracing, we need our laboratories. At this time, I'll just call on our darling brother, Dr. Olafinreye, to come ahead and just address some of the myths that we hear about coronavirus. God bless you.
Praise the Lord. Great. So you all agree with me that's been a great time this morning. Powerful presentations by Dr. Frempong. really well simplified. I don't think it can be, better simplified than that. And great presentation by Pastor Mrs. as well on the COVID-19 testing. So I'm going to go ahead and start talking about the controversial areas. So areas where people have been, a lot of information on the internet, on, talking about different things you can do or how you can prevent COVID-19, but they're not evidence-based. The first thing I want to address is, this is the major fear of most people. People think if you have COVID-19, you're going to die. That's the impression that, once you have COVID-19, everybody start getting worried. He has contacted COVID-19. Maybe he's not going to survive. He's going to die. But the truth about it is, and this is directly from the WHO, the truth about it is most people who get COVID-19 have mild or moderate symptoms, and they can recover with supportive care. So more than 80% of people with COVID-19 actually survive it. They live, they overcome it, and they survive it. So COVID-19, yes, is highly contagious, but it's not that it's killing everybody that is affected. So please take note of that. So that kind of take away a lot of stress, a lot of worries with COVID-19. So most people who get COVID-19 recover from it. So that's point number one that I want to stress here. Now in most institutions, we're doing what we call the thermal scanner. You're scanning people for temperature to make sure they don't have fever. This is just a screening tool to make sure that people with possible symptoms of COVID-19 are not, coming in contact with other people at the workplace, at any institutional setting. And this scanner, it's only testing for temperature, nothing more than that. So the fact that you are scanned at your workplace as you're coming in, in the morning or anytime you resume work, and it says, oh, no, you're fine, doesn't mean you don't have COVID-19. It doesn't mean that you've been excluded. So the thermal scanner cannot identify COVID-19. It's only a screening tool, just to check temperature. And temperature fever can be from any type of, so many infectious diseases, so many viral infections. But that's kind of the first screening tool that most institutions can use at this time, at least to screen people coming to work, the essential workers, for example. Most hospitals do this now. So in most hospitals, as you come in, you undergo the screening process. Next one is, and this has created a lot of discussions on the social media, on the internet, particularly coming from one of the leaders in the world. So, and this has to do with bleach, use of disinfectants. Can spraying and introduction of bleach and other disinfectant into your body protect you against COVID-19? And the answer is no. Please do not drink bleach. Please do not drink Clorox in an attempt to cure COVID-19. Do not do that. That is not right. So do not, under any circumstances, spray or introduce bleach or any other disinfectant into your body. These substances can be poisonous if ingested and cause irritation and damage to your skin. And this is directly from the WHO website. So disinfectant, please, they're very good for cleaning stuff, for disinfecting surfaces, but not for your body. Please do not do that. So just to clear that out of just to make sure that we don't fall into that. Can cold weather and snow? Yeah, people have been saying, well, maybe snow, the virus cannot survive in a very cold weather. Snow is going to kill it. The truth is, we don't know. We have no clinical evidence, no scientific background or backing to support that. So we don't know if cold weather will kill the virus. And we've seen, coronavirus in areas of extreme cold weather, and that kind of tells us that maybe cold weather does not, or snow does not actually kill the virus. So please also take note of that. What about, can we go to the next? So that's for the cold weather. Then the next one I have here, why waiting for that? Can exposure to the sun or high temperature prevent COVID-19. This, in the same vein, we don't know that sun, people have been talking about you staying under the sun, that maybe in some temperate regions of the world, COVID-19 may not survive. But that is not true. We've seen COVID-19 in almost every part of the world, even in areas with high temperature in Africa, even in a certain part of of US where the temperature is really high. So we really don't know. So high temperature has not been confirmed to prevent COVID-19. So in any part of the world, anywhere you are, at any time of season, the most important thing is to take all the precautions, the contact precautions to prevent COVID-19. Don't start thinking that staying in one part of the world will probably lower your risk of COVID-19. We don't know. We don't have that information yet. Can exposure to the sun, the same thing here? Can hot bath? Yes. A lot of people have been taking hot shower, thinking that yes, someone say the COVID-19 cannot withstand high temperature, and then they start taking shower every now and then, every 2 hours, some every 4 hours, with the hope that this will kill the virus. The truth of the matter is this is also not true. There's no evidence, no clinical studies or clinical trial that has really confirmed this, that taking hot bath, hot shower can actually kill the virus and all that. What about steam inhalation? We tend to do this a lot, particularly in a certain part of Africa. When you have a common cold, you put some menthol in a very hot water and you cover yourself up for a couple of minutes, and then you get the steam inhalation. And people think that this may also kill the virus. But we still do not have that evidence. And this is also from the WHO website. It's saying that steam therapy, yes, it may actually thin the mucus. In people with upper respiratory tract infection, with very thick mucus, the steam inhalation may actually thin it. But we don't know whether it kills the virus, including the COVID-19 virus. So it's not something that is highly, if you've been doing it for other reasons and you want to continue to do it without, without any significant harm to the body, because steam inhalation can also cause bone injury. So you have to be very careful of what you do. But there's really no evidence, no clinical evidence to suggest that steam inhalation kills the coronavirus. Just another point to be aware of. Hand dryers. I'm sure a lot of women were seeing this on the internet, that you can use hand dryers, and they're actually giving out different techniques of using hand dryer to kill the coronavirus. Also, this has no scientific background to it. So please be careful of what you do, because sometimes this can actually cause injury as well. Unexpected injury can result as a result of doing all these things. So be careful with that. Garlic. A lot of people, particularly from certain parts of the world, started making different type of concoctions with garlic and putting all sorts of things inside juice and all that, and drinking it every day, in the hope of preventing or curing COVID-19. I want to say that garlic is definitely a healthy food and may have some antimicrobial properties, but we really don't know if it cures or prevents COVID-19. So don't start thinking that, well, if you have a COVID-19, I have a recipe for you that's going to take care of it. People have been passing all this information on the internet. We don't know. And this is directly from the WHO website. What about pepper? We like spicy food where I come from. You eat a lot of pepper, and people have been saying, yes, the spicy food can kill COVID-19. But yes, the spicy food are delicious, particularly for some of us who likes hot and spicy food. But the truth is, there's no scientific or clinical backing to support that spicy food or hot food, fire and all that can actually prevent or even treat COVID-19. I'm not saying don't add pepper to your food. If it's what you enjoy, yes, please continue to do that. But it doesn't mean, but don't take it as a sole form of treatment or preventive therapy for COVID-19. So we still strongly recommend to follow the acronym WOMEN in the prevention of COVID-19 and not just relying on your spicy and hot pepper food. Alcohol, yes. Some also suggested or indicated that alcohol may also prevent COVID-19. This also has no scientific background. I believe most of us here do not, indulge in alcohol drinking. But I want to stress that alcohol also has now been shown. We don't have any scientific background to support that as well. Antibiotics. A lot of people have been, taking antibiotics, particularly recommending antibiotics, particularly in areas where they can get antibiotics over the counter, using antibiotics to treat COVID-19. So antibiotics is mainly to treat bacterial infection. The coronavirus, it's a virus. So antibiotic has no effect on the viral infection, but it can prevent secondary bacterial infection. But we typically do not recommend antibacterial for viral infection unless it becomes complicated. So just something to be aware of. Antibiotics are not effective in preventing coronavirus. Now, are there any specific medicines to prevent or treat coronavirus? I want to say that there are a lot of clinical trials ongoing now looking for treatment for coronavirus. We still don't know. There's so many unknowns with coronavirus. There are more than 200 clinical trials ongoing looking at different types of agents to treat coronavirus. And we're hoping that one day we will come up with a specific treatment for coronavirus. But there's one drug that Dr. Frempong mentioned. It's an antiviral drug which has been shown to shorten the duration of the disease in those with moderate to severe symptoms, those who are hospitalized in the hospital. So for now, that's the only medication that has been shown to show some, beneficial effect, not really treating or, killing the virus, but shortening the duration of the symptoms. This is also an area of controversy, and unfortunately, even some of church leaders have even, kind of talked about this, the 5G network. I'm sure we are all aware. We saw this on the internet, that the 5G network spread COVID-19. And the truth about it is COVID-19 is caused by a virus. I'm not an engineer, but I know that this is a viral infection, and it's not spread by a radio waves or mobile network. This is a viral infection that we know the mechanism of how these viruses, how they spread. So this has nothing to do with 5G network. So COVID-19, it's a viral infection that has no relation, from what we know, with 5G mobile network. I will end here, and I want to ask that if we do have any question, please send them to us. We'll be happy to address those questions. I'm going to call on the Pastor Mrs. To please join me on the podium as we take some of the questions related to COVID-19. And I do have some of those questions as well, so I'll probably start with those. Thank you. So please, if you have any specific question related to coronavirus or COVID-19, yes, you can send them right now. And we will answer those questions, and we address those questions as much as possible.
Yeah, Sister Ida is here. She has the questions.
So I also have Sister Ida here that will be helping us out with the questions.
The first question I have here is, why do I have to wear a mask? Do we really need to wear a mask?
That's a great question. I'll let my pastor Mrs. start with that.
Praise the Lord. Yeah, so the CDC has the recommendation that we should wear masks, especially in places where we are not able to practice physical distancing. Physical distancing means we should keep about 6 feet between ourselves, and which we're trying to do on the stage right now, which is why we're not wearing masks. So physical distancing, if you can keep it, like we said, it's a virus. That means it doesn't move on its own. It actually, you know, if I'm infected now and I have it, it's just around me and it drops here. And the envelope is pretty fragile, so that by the time it drops, many times it just gets destroyed. Okay? But then if we're close, then he can breathe in my own air and breathe in the droplets and things like that. So in areas where maybe at work or in church where I have to talk closely to people and things like that, then you have to wear a mask. Your mask protects others from you. So if I'm wearing a mask, then it's showing respect to other people, and it's helping to prevent them from getting infected, because people who are asymptomatic, that they're not sick and they're not, or before the symptoms start, or, you know, they could still be passing the virus. So yes, please wear masks. By the time we open church, we will expect everybody to be wearing a mask, except when you're actually on the pulpit. Thank you.
Thank you, Pastor Kemi. The next question here is a two-in-one question. Is coronavirus lab cultured or man-made or zoonotic or naturally originated? That's the first part of the question. Is there any genome sequencing data to confirm the actual source? I can take it again. Okay.
I think I get it. All right. Should I go, or you want to go?
Please do.
So as everybody has been saying since we started, there's still so many things that are unknown about this virus. And unfortunately, because of the devastation it has caused, it has also become a political thing, meaning that there will be also efforts for people to suppress information just because of the politics of it. But from what has been known thus far, yes, there are genomic sequencing, and they claim it came from animals. It's related to the coronavirus that has been found in animals. So that is the prevailing scientific thought right now. We don't think it was lab developed. But I don't know if Dr. Dipo has anything else.
Yeah, I think I agree with Pastor Kemi. And the same thing was alluded to by Dr. Frempong during his presentation, that the virus came from animals. And normally this is something that affects animals and find its way to, due to some genetic transformation and able to survive and cause disease in humans. So that's kind of of course there are other concerns about the origin of the virus from China. A lot of them are unclear. A lot of them are political. But what we know and what the CDC and WHO make us understand that this is a form of virus that is in animals, but now it's causing infection in human. And coronavirus is not the this SARS-CoV-2 is not the only one. There are other coronaviruses that also affect human beings as well.
The next question here is, why have African countries seen less reported cases of COVID-19? Why have African countries seen less reported cases of COVID-19? I
will take that. So if you follow the trend of COVID-19, there's a corona worldometer that kind of publishes every day and updates the incidence of coronavirus in every country. The main problem, which I think, this is my own personal opinion, with African countries, is the availability of testing. In some country, I could remember there was one particular country 2 months ago, and they had no case of coronavirus. And someone was interviewed, and the response was, well, we don't have any case of coronavirus because we don't have a testing kit. So if you don't have a testing kit, then the number of people that you test determines, the number of cases that you actually present to the whole world. I think that's major thing. It will be interesting to see what is the total number of people being tested in those countries and what is the incidence of new cases of coronaviruses from those countries. And I can tell you in the US is probably doing the most number of testing now. And you can see the US is leading in terms of, we have the highest number, over 4 million, over 2 million cases right now. So I think it has to do with testing. That's the key thing. But Pastor Kemi may want to add to that as well.
I agree with you that if you're not testing, you won't find it. That's sure. But I do know that, because I have colleagues back in Africa, and they are claiming that even the people that have had it, they're not spreading it as rapidly, so it seems better contained. But as we always say, there's still so much we don't know about this virus, and we wonder what the story will be like in another 6 months.
All right, the next question here is, there's a hypothesis that BCG vaccine given to African descent to prevent tuberculosis could be a factor in low mortality rate in African nations. What is your opinion on that?
So low mortality rate of coronavirus. Yeah, so again, there's no scientific backing for that. Thinking that, I think the study probably looked at the association of people who are vaccinated with BCG with mortality rate. Again, the BCG, this is kind of a vaccination for a bacteria. How that affects mortality of coronavirus, it's really unknown. So we really don't have any data to support that, that BCG is protective in any way.
Just to add to that, the fact that one thing you should know about the coronavirus is that it's not just the virus itself that causes the disease, makes it really bad, but it's actually also the way the body responds to the virus. And as we keep saying, studies are ongoing, and I know that one of the kind of hypotheses that they have is that, because like I said, I do know that some people really think that Africans are being infected, but that, it's not that bad. And one of the hypotheses is the BCG, the chronic infections that people have, and just the fact that people have been exposed to so much disease that maybe our immune system is not reacting to the virus the same way it does in developed countries. But all those are just hypotheses. It still has to be studied, it still has to be observed, and time will tell. Time will tell.
I completely agree with that. So there's so many unknowns, a lot of things that we thought were protective or could serve as therapeutic as therapy for COVID-19. We are now, getting more data showing that they're not. Like chloroquine, for example. Early on, we're thinking, maybe chloroquine is the answer. Maybe chloroquine is the reason why we're not having a lot of cases of COVID in Africa, because they all use chloroquine. But now, even data from the US is saying that no, that's not the case. So I think as things go, as more studies become published, we'll probably get a clearer picture of COVID-19 treatment.
Well, this is a question that was just posted, so I'm going to read it from my phone. Despite previous concerns about RNA vaccine in medical field, do you think ongoing developments on the trials that are going on of RNA vaccine will be safe to administer in the future?
The only thing I can tell you is that we don't know whether it's going to be safe or not safe, whether it's going to be possible or not. Until those studies are completed, we really can't tell. I think the best thing we can do at this point is taking precautions to prevent contacting the virus in the first place. And not only that, because this is something we're probably going to live with for some time, and also taking good care of ourselves, because we do know that people that are healthy, that are taking good care of themselves without comorbidities, they tend to do well even when they contract the infection. So by taking good care of ourselves and taking all the precautions, I think we can overcome COVID and deal with it and know how to live with it.
Ida, thank you. Oh, Pastor says you should get some more questions.
It says, what is the medication for the cure? I believe it was mentioned in the slide, but maybe you can refresh.
We don't have any cure yet, but there's that remdesivir that Dr. Frempong mentioned that has been shown in the US to shorten the duration of symptoms of the disease. But at this point, we still do not have any cure for COVID-19.
What should I do if I come in contact with COVID-19 positive individuals?
What should we do? So I think that's where it comes with testing. Okay, so if you come in contact, because like we said, all the protesting that's taking place now, people are being exposed. People who are protesting for justice, right? So they're being exposed and they're being told to go for testing. Or if you happen to work somewhere and you find out that one of your coworkers was COVID positive, so you need to be tested. And once you call your physician, then they'll tell you where to go. There are many pharmacies, there are many collection centers all around the different cities, but then you still need to talk to your physician to be able to get those testings done for now. So when you're tested, if you're positive, you need to isolate. But if not, you still need to isolate. That's the truth. So maybe the best answer would be if you're in contact with someone who has COVID and you find out, you need to self-isolate within your house. They have ways. They tell you stay in your room, use your separate bathroom and all that. But we do know that there are difficulties in certain families where you don't have that much space. So it's best to make sure that you are doing your face masks, you're doing your social distancing, so that even if you are in contact with someone, the chances that you got infected will be less. But then if you are meant to isolate, if possible, get tested to confirm whether you are infected. But really, I don't know whether you want to add to that.
I completely agree with that. I think the first step is self-isolation. As soon as you come in contact with COVID-confirmed person, you really want to self-isolate and contact your primary care, your healthcare provider, and they will kind of guide you. And most of the time, if you have no symptoms, you may not be tested. They can just ask you to self-isolate for at least 2 weeks, and after that, if you have no symptoms, you may be tested just to be sure that you're not going to be, you're not going to be, transmitting the infections to other people. Because we do know that there are asymptomatic carriers as well.
All right. This question says, is the pandemic over? If not, when will it end?
I'll leave that to Dr. Olafere.
Well, if you're following the coronavirus updates online, you will see that every day there are new cases, even in the U.S. Last time I checked, I think we had about 4,000 new cases even in the U.S. in the last 24 hours. So we're still having new cases. when this is going to end, we really don't know. But we do know that with taking the necessary precautions, we may be able to resume, activities back gradually. And the major concern is that, yes, COVID-19, it's ongoing, and it may linger on for some time. But we are also having some other, unwanted effects of the COVID-19 that are not COVID-19 related, kind of situations brought about, like increase, domestic violence, because of people staying indoor, and things like that, that the government has to deal with. So those are part of the reasons why the restrictions and the movement, it's kind of been relaxed a little bit, just to make sure that we take care of other aspects as well.
All right. More questions on YouTube. In terms of how fast viruses mutate, how are researchers taking this into factor when designing their ideal vaccine?
I'm not sure. I'm not an expert in vaccines, but I do know that, the NIH is on top of this, the CDC is on top of it, making sure that things are done the right way. I'll tell you, there's a lot of funding, which I also kind of, kind of looked into from the cardiovascular perspective. A lot of funding being pushed out there to support studies, research, and those studies are thoroughly reviewed to make sure that they're done right.
I was just going to add that already, I think, in the news within the past 2 days, they've already said even the COVID virus has started mutating, and claim that because of the mutations, some strains are more easier to infect people than others. So it's already happening. It's a part of the history of viruses, and that's one of the reasons why even the flu virus, you have to take vaccines every year because the mutations keep occurring. So as Dr. Lafreniere said, the researchers would make sure that, it's part of research is being a step ahead of the mutations and it's a part of the natural history of viruses. It will happen, but then we have to take that into account even as they're trying to get vaccines. Okay.
All right. Our next question. Do patients who recover from COVID-19 really develop antibodies? And how long after recovery are they able to produce it for? Also, what is the explanation?
One question at a time. One question at a time. Pastor is giving us a closing. All right, praise the Lord. So yes, people develop antibodies, but then, as we have said, these things, research is still ongoing. So they don't yet know how long these antibodies would keep on being produced, and they're producing different types of antibodies. So some have been found to be protective, some are not protective. And this is just an area where there's so much research going on, but antibodies are produced, but then they're not even sure, the fact that you've been exposed before and you had it before, right now they're not sure that means you can never have it. But it's just information that is not known because they're still working on it, all right? So it's an ongoing area of research.
Yeah, that brings us to the follow-up question.
Okay.
Also, what is the explanation for those who catch the virus multiple times?
All right, so I guess that's it.
So yeah, so we don't know. Reinfection has been reported, I think, in China, that people were infected with the COVID virus, and they were tested negative and then tested positive again. But it could also be based because of the testing as well, as Pastor Mrs. mentioned earlier, that the initial testings were not that accurate. So I think a lot of factors come into it, and that's part of the fact that it's all, a lot of unknowns. Things are changing every day. The testing modality is changing. We're getting new information, as more and more people, as more and more data come in.
All right, next question. Can sharing a microphone spread the coronavirus?
Yeah, I think any contact, as you noticed, I've been holding this microphone. This is my own microphone, so I'm not sharing any microphone until I'm done today. And which is important. Anything that you're gonna touch, you want to make sure that it's all thoroughly cleaned and to limit the transmission of the virus. Anything you touch and then multiple people are touching, definitely you can spread the virus.
Just to say also that this thing is new and information keeps changing. Initially, there was a lot of emphasis on touch surfaces, and cleaning everything and things like that. But recently, whenever you look at all these websites, I'm talking about like CDC website now, things keep changing. And now there's less emphasis on the virus surviving on hard surfaces and things like that. So more emphasis on physical distancing. That's more important now. But a microphone is special because we're actually, our respiratory tract, we're breathing onto it, right? So it's more special. But generally, we'll still do our best to keep all surfaces clean. But that emphasis really is reducing gradually.
Thank you. Next question. With most of all, if not all states being open now for businesses, there are a lot of concerns of COVID-19 resurfacing and becoming more serious again. What do you think of this? Should we be worried?
Yeah, I would say it's definitely a concern that things may get worse in terms of the infection rate, but we're all going to be vigilant and looking out to see if such things happen and how to kind of prevent a surge in the incidence of COVID-19. But I would say that it's a tough decision, particularly looking at so many other factors. We've been concentrating only on COVID and trying to prevent and reduce mortality related to COVID. But people are dying from other things as well at a higher rate. Like, I'll tell you from my own, personal experience as a cardiologist, and I deal with a lot of patients with heart attacks. During the COVID period, when everybody, things were all locked down, there's a significant reduction in people with heart attacks coming to the hospital. What happened? A lot of them were dying at home because of not coming. So by doing things, trying to see how can we maintain balance here while still dealing with COVID, with the information that we have, with the data that we have, and trying to curtail it without affecting other aspects of life. I think that's where the balance has to come in.
Yeah, so, yes, there's a concern for a second surge, but as Dr. Lafreniere has said, trying to manage COVID has affected so many things, including the financial situation of the whole world. Everything practically crashed. So, therefore, people are concerned that they don't want to do another lockdown. And the truth of the matter is COVID is here to stay, and we all have to learn to live with it. So the new normal is going to be different, but we have to all find ways to establish a new normal because we cannot all sit at home all day, every day, and expect the world to continue.
Thank you. Next question. Please, could you highlight how COVID-19 causes heart injuries and multiple organ dysfunction syndrome?
Oh, great. So, the coronavirus, as Dr. Frempong alluded to, one of the things it does, it incites what we call inflammatory cytokine storm. So it induces a lot of inflammatory response throughout the body. And what that also does, from what we know, it increases the thrombogenicity. We have what we call widespread thromboembolic phenomenon. So clot develops, particularly in the respiratory tract. And not only does clot develops, which kind of contributes to the respiratory distress, We can also have inflammation around the heart. We've seen a lot of patients with COVID that tends to develop what we call inflammatory process, myocarditis, pericarditis around the heart. And patients that develop those complications do worse. We've seen that patients with existing coronary artery disease, patients with existing cardiovascular disease, heart failure, arrhythmias, they have higher mortality than patients without those symptoms. How do we, determine, can we know which patient is going to develop cytokine storm and all these complications? We really don't know. The only thing we know is that those with pre-existing conditions are more likely to develop those cardiovascular complications of coronavirus. And now it's more mainly supportive therapy that we can offer, and supportive therapy, those requiring with respiratory distress, requiring some mechanical ventilation as well.
Thank you. Last but one question. For how long can an asymptomatic carrier be in the carrier state? How long can they carry the virus for?
The studies are still ongoing. In actual fact, I mean, honestly, each day you go into the news, you see something different. So it's still ongoing to see how much asymptomatic people are actually passing the virus. One day they say, oh, a lot of asymptomatic people are doing that. The next day they say, oh, actually it's symptomatic people that are passing. So it keeps changing. We don't really have an answer for that yet.
Okay.
So we need more testing. Because right now, in the US, for example, they're not testing people that don't have symptoms most of the time. So that's why, when I was talking about home testing, we need to get to that stage where whenever you want to be tested, you can be tested before we really have all the answers.
I just want to, round up by saying that I think the key message here is the coronavirus may linger on, may stay with us for some time. But then life must continue. And in doing so, we're still going to continue to take all those precautions we've been doing in the last 3-4 months, making sure that, social distancing as much as possible. In some areas, you can't practice social distancing. For example, when I'm at work and I have to operate on the patient, but you cover yourself up with all the necessary protective devices. But you practice what is practicable, in terms of social distancing, wearing a mask at all time as much as possible. But this is probably going to stay on for some time with us.
Thank you. I think we can use this as the last question. Is there any ongoing plan to resume in-house church service soon? And what are the precautions taken by the church to ensure the safety of members and the community?
I think I will hand over that question to pastors. Praise the Lord. Well, I do know that the church leadership has been meeting, and they do have a committee that they have set up to look into how we reopen, because as you said, coronavirus is here for the time being, and we do care about the safety of all our church members. We love all of them, and we do not want to lose anybody. We thank God that so far God has spared us. As pastors, we know at least 3 church members that got infected, and we thank God that they have recovered totally and completely. So we do know it's real. But then, despite that, we cannot live by fear. We have to move on by faith, knowing that God is our healer, God is our protector, God is our deliverer. And I know the church has plans to do it in phases. And I think in the next 2 weeks, our workers are going to be asked to come back by God's grace in 2 weeks' time. And after that, we're going to see step by step how exactly we intend to proceed. The church has lots of face masks, some the women made. Now that things have opened up a bit more, we're able to buy actual proper masks, and we've bought a lot. We do have a lot of cleaning products. We will be getting external people to also help us cleaning. So we're doing our own part. But we do realize that at the end of it all, we serve a sovereign God, and our safety is actually in his hands. So, of course, our prayer band too will be praying. Workers, you will be fasting. We'll be trusting God to keep us all safe. But life really does have to go on, and everybody has to start looking for a new normal. And when people do come back, by God's grace, we're going to have a lot of social distancing also in the church. Our elderly people, we will advise to watch us online. People with health challenges should watch us online. And people who have coughs or are not feeling well, God will heal them, but they should please practice the faith at home. Amen. So anybody coming in, we expect you to be feeling good before you come to church. If we see anybody that looks sick, we're going to send you back home. So we will do our part, but there will be also things that will be expected of the church members. I think they're looking into the possibility of, I know some churches have people pre-register. We're not yet sure how that will work out here. So like I said, we're doing it in phases. Our workers will come in first in 2 weeks' time by God's grace. They're sending out surveys to find out how many church members actually want to come in. And the Bible makes it clear that the just shall live by faith. Nobody will be excommunicated for not coming back to church. It's not going to be compulsory. If you feel you have issues, you have sick people at home, whatever it might be, your faith doesn't want to come, we'll encourage you, but we're not going to force anybody. But as a church, we're looking into how to reopen. And I think we're going to hand over the service to Pastor Esa at this time.
Thank you so much.
Thank you, Ida. God bless you. Thank you a lot, Dr. Lafiroye. We appreciate you. And thanks to the medical team. And thanks to Dr. Frempong. And help us say a big thank you to him. We appreciate everything he did.
And thanks God to everyone
bless
for
you.
watching.
Yeah, thank you, everyone. Thanks, Pastor, for giving us the opportunity. We appreciate you.